Hello, my name is Angela Wolfe, and I'm a PharmD candidate from California North State University. Today I'll be presenting on the selective serotonin reuptake inhibitor, Lexapro, which also goes by the generic name Escitalopram. It comes in 3 different tablet strengths, the 5 milligram tablet, 10 milligram tablet, and 20 milligram tablet, as well as a 5 milligram per 5 ml solution. So some things you should tell your doctor before taking this drug is if you're allergic to this drug or any component of the drug, any allergies to any foods or any other substances. Also, if you're taking medications such as linezolid, methylene blue, citalopram, or pimozide, and if you've taken any certain drugs for depression or Parkinson's disease within the last 14 days. Now, what is this drug used for? It's used to treat low mood, such as depression, and it can be used to treat anxiety. It can also be given to you for other reasons, and that would be something to talk to your doctor about. So what are some things you need to know while taking this drug? You should avoid driving or doing any other tasks until you know how this drug affects you. It can cause you to be possibly a little dizzy or drowsy. You also don't want to stop taking this drug suddenly without talking to your doctor first. You want to make sure to avoid drinking alcohol as well while taking this drug. When taking this drug for depression, you can see some improvement in your sleep and your appetite initially, but other things like low mood can take up to 4 weeks to get better. This drug can also increase the chance of bleeding, and if you're 65 or older, you want to make sure to be careful while using this drug. You can experience some more side effects. And if you are pregnant or planning to get pregnant or breastfeeding, you want to let your doctor know. So some side effects that you need to tell your doctor about right away are signs of an allergic reaction, signs of low sodium levels like headache, trouble focusing, memory problems, changes in balance. Also, you'd like to let your doctor know about any signs of bleeding, seizures, fever, or chills. If you experience a painful erection or an erection that lasts longer than 4 hours, any eye pain, changes in eyesight, swelling or redness in or around the eye, and any signs of serotonin syndrome, which can include agitation, changes in balance, confusion, and hallucinations. Some other side effects of this medication are feeling dizzy, sleepy, tired, or weak, upset stomach, diarrhea or constipation, dry mouth, trouble sleeping, excessive sweating, can also experience flu-like symptoms, such as like a runny nose or headache, and also yawning. Now, when it comes to storage, you want to make sure to store this medication at room temperature in a dry place. Do not store it in a place like the bathroom that can get kind of humid or moist. You want to make sure to keep this medication in a safe place and out of reach of children and pets. Now, the best way to take this medication is you could take it with or without food. You want to make sure to continue taking this medication as long as you've been told by your doctor, even if you do start to feel well. For the oral solution, you want to make sure to measure the liquid dose carefully using some kind of measuring device that might come with the medication. If there isn't one, then you can ask your pharmacist for a measuring tool. Now, if you miss a dose, you want to make sure to take that dose as soon as you remember, but if it's close to the time of your next dose, go ahead and skip that missed dose and just go back to your normal routine. Do not take 2 doses at the same time or double up on doses. So now talking about the indication and mechanism of action of Lexapro. The FDA label indication for Lexapro include major depressive disorder and generalized anxiety disorder. In major depressive disorder, it's used as acute and maintenance treatment, and in generalized anxiety disorder, it's used in the acute treatment of generalized anxiety disorder. It's also used off-label for other behavioral disorders. Now, Lexapro is the S-enantiomer of the derivative of citalopram. So escitalopram is a little bit more selective when it inhibits the reuptake of serotonin, and it doesn't have any effect on norepinephrine or dopamine reuptake. So talking about drug-drug interactions with Lexapro or escitalopram, many of these drug interactions have to do with the enhancing effect of SSRIs and the serotonergic effect of escitalopram. And this can lead to something we call serotonin syndrome, which can be a serious adverse effect. And some of these medications include bromopride, citalopram, duloxetine, linezolid, methylene blue, a drug class called monoamine oxidase inhibitors, which are a type of antidepressant, as well as residuline and selegiline. To note, if a patient is taking citalopram with escitalopram, this can also enhance the antiplatelet effects of escitalopram. And if escitalopram is taken with citalopram, this can also enhance QTC prolonging effects. For dosing and administration for Lexapro, in adults, when used for major depressive and generalized anxiety disorder, we can start with 10 milligrams by mouth once daily, and this dose can be increased by increments of 10 after 1 or more weeks, just based on the patient's response. And we would titrate up to a max dose of 20 milligrams once daily. For children, we don't really see this dosed in children under 12 years old, but if they're 12 years old or older, it could be used in depression. Dosing for depression, we can start with 10 milligrams once daily by mouth, and this can be increased to 20 milligrams per day after at least 3 weeks. There are many other indications for the dosing of Lexapro, which I won't list here. Some side effects of escitalopram include diarrhea, nausea, ejaculatory disorder, drowsiness, headache, or insomnia. Some warning and precautions in special populations include CYP2C19 poor metabolizers. In poor metabolizers of CYP2C19, escitalopram may be increased in the body. Also, we want to be careful in the elderly as the bioavailability and half-life are increased by 50%, so dose adjustments might be necessary. So some monitoring parameters can include ECG for patients who are at increased risk for QT prolonging effects. We can also monitor electrolytes such as potassium and magnesium. Also liver and renal function, serum sodium. We also want to closely monitor patients for any changes in behavior such as depression or worsening of depression, suicidality, psychosis, especially during the first 1 to 2 months of therapy or in adjusting patient's dose. We also want to look out for signs and symptoms of serotonin syndrome, and we can monitor for GI symptoms such as nausea, vomiting, or diarrhea. Dose adjustments can also be made for Lexapro, specifically in patients with altered kidney function, a creatinine clearance less than 20 milliliters per minute. We can dose them at 5 milligrams once daily, and we can titrate this dose based on patient's response and how they tolerate it. Also in hepatic impairment, the level of hepatic impairment wasn't specified, but we can give the patient 10 milligrams once daily. And this is for adult patients. And to conclude, here are my references.